Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today I am excited to be with Dr. Sam Shamardi. Dr. Shamardi is a diplomate of the American Board of Periodontology and Implant Surgery and practices full-time while teaching part-time at the Harvard Division of Periodontics. He's a member of the Catapult Education Speakers Bureau and lectures on topics within periodontics, as well as hearing loss in dentistry, finance, and non-surgical maintenance. Dr. Shamardi is an entrepreneur with his revolutionary EarAid product and the author of the Financial Survival Guide for Dentists, geared towards helping early career doctors establish a foundation in the business aspect of their profession. Welcome to the podcast, Dr. Shamardi.
Thank you. Pleasure to be here.
Yeah, I've been looking forward to our conversation. You've done a lot of things. I mean, you're still a young man, uh, and the older I get, the more I realize how relative young is. But
Exactly.
you are a young man, and yet you've done all these things. So,
Yeah.
and still practicing at a full-time level.
Yeah.
So I'm always curious to ask a question like this. What drives you and keeps inspiring you?
Yeah, it's a good question. I mean, I think at the end of the day, it's really just trying to bring new solutions. I think that's the big thing. Obviously, practicing is our bread and butter, but I think once you are practicing and you start identifying things within practice that maybe you think, hey, could this be done better? Could this be done differently? Or are there certain things within our day-to-day that we're missing that, are really important? And that kind of evolved into the hearing protection side of things. It evolved into the finance side of things because you start practicing and you start realizing that the clinical dentistry is only really a very small percentage of your day to day, and that's the easy part. It's everything else that you're really having to manage and struggle and learn on the fly. So having those kinds of experiences after starting to work for a couple of years and trying to then think, okay, well, what can I do to help try and bring some kind of a solution to this and address this? I think that's really where that drive is coming from.
Yeah, that's great. And I think, I mean, most people are experiencing, feeling these things, but I think asking that question, what can be done to improve? What can I do? Those are great questions to ask because I'm convinced that the majority of people are accepting, adapting. I mean, there's a point for adaptation, right? But like this is, I guess, just the way it is, and I've got to
Yes.
be okay with these things. So I love that question of saying, well, what could be done better? So that whole innovative, creative kind of side, I like that.
Yeah, no, thanks. And I mean, I think you really hit it. I think, once you start working, everything is such a whirlwind. Things are so high paced. We're literally running with our tails on fire, and there's just so much going on and so much responsibility that I think being able to ask those questions sometimes is something tough to do, not because we're not asking ourselves that, but because we've just got so much on our plate that we're just trying to get what we can and keep running and stay afloat and
Yeah.
but I do think, one of the things you'll realize is that if you're asking yourself these questions, you'll find that your friends are, and if you and your friends are, you'll start realizing that everybody else is. And I think the sooner people accept that these questions aren't just our own and these experiences aren't unique
Mm.
necessarily to us, but that everybody's going through some form of this,
Yeah.
that's where I think it can open the door to doing a lot.
Yeah. Yeah. Yeah, I think that, I mean, everything that's gotten better in life, easier, the advancements, they all started with, well, this is a problem we've run into, or this doesn't seem like
Yep.
it could be the best it could be, right? And so, but not everybody's mind is oriented, I think, towards being able to see possibility. So I'd always
It's
love
true.
meeting people who do tend to think that way. And it's like, hey, what do you come up with? What do you think about this? So let's kind of shift slightly, although it's really
Sure.
kind of dovetails, I think, off of the tail on fire that you that you said. I was picturing that you staying calm because you have a calm feel about you, at least in this moment of us having a conversation. So I was trying to picture you with your tail on fire. But let's talk about some of the nitty-gritty realities,
Yeah,
maybe, of clinic life.
sure.
What have you found personally, and maybe also seen in with your
Mhm.
colleagues as far as the most stressful aspects of practice?
Boy, yeah, that's a great question that really we could do hours on. I think, on the front end, earlier on, I think there's a big oh no moment of just the finance and business side. We learn the clinical skills to whatever extent we can, and we graduate and think, okay, we're prepared, and then you start practicing and you realize again, there's a whole business side to the field, whether you are owning a practice or being an associate or working as an independent contractor. All these things have their own, back and forth to them, their own song and dance. And I think that's the first part where you start realizing, shoot, this is way more than the clinical. So I think the financial aspect and just trying to figure out how to establish yourself and just get a footing and what insurances you need and how to pay back your loans and all that. I think that's really the big upfront, oh no type situation. But I think as you progress and you're practicing more and once you hit that 10 plus year mark, I think then things start to shift because you start feeling more comfortable with that, but then you start hitting the roadblock with some of the physical side of things, some of the just musculoskeletal breakdown. There's saying about 93% of dental professionals have some form, if not multiple, of musculoskeletal issues. So, the back and neck and hand issues that maybe you notice on a low scale here and there, but you were earlier in your career, you were younger, you were able to recuperate quicker. Then those things start adding up and you start noticing that a lot more. So the physical side starts to really kind of hit a lot harder. And then when you progress that kind of 15 to 20 and beyond, I think kind of that last layer that also starts to hit hard is the burnout. I think there's a lot of stress, unfortunately, involved with our field. It's not exactly the most positive environment,
Mhm.
not so much for us, but of course, the patients. Nobody's looking forward to seeing us. And I think there you see a lot of the issues with just burnout, mental fatigue, a lot of kind of it's not even necessarily a midlife crisis, but kind of just what do I do from here? How do I manage this? And the need to try and just kind of take a breather. And sometimes, depending on a lot of the decisions we made earlier on in our career,
Mhm.
they play a big role in being able to determine whether we're in a position later to maybe take a little bit more time if we need, or maybe slow the pace and be able to kind of manage some of these things better. But sometimes we don't have that possibility, and now we're really burning the candle at both ends. And I think that's kind of those are the three big trends that I tend to see and have seen on my own and experienced and seen friends and colleagues as well.
Yeah. I like seeing it through phases like that too, like you broke it down. I think it's kind of easier to follow. And I do think that there tends to be phases like that. And I also think it's not what's being asked of small business professionals is unreasonable,
Yes.
which I suppose is what's led into the success of DSOs and alternate models, right? But to be able to be as smart as you need to be intellectually, as technically skilled as you need to be, then that whole business piece where there was not sufficient training in
Yep.
education, not enough time really to prioritize that, which seems kind of crazy to say, but to be adept at those elements and how you're going to get to that, right? But then also the
Mhm.
piece of being suddenly finding yourself as a leader of a growing team of people, and
Yep.
when did those skills get developed? Suddenly now I've got all these people I need to help bring together as a unit so we can all thrive and accomplish our mission, and yet I don't. And I think a lot of dentists are they're not by nature
Yeah.
oriented that way, which is part of why they went into dentistry in the first place. But now suddenly I'm supposed to do this too. What's your take on that?
Yeah, no, these are all phenomenal points. I mean, like you said in your last comment, dentists will think, well, I'm in a solo field. I'll be able to, block myself off in the room, focus on my job and do what I do. But then, like you said, you come out and you have got that responsibility where it's like, well, no, you have to actually, have leadership skills. You have to be able to direct your assistant, your staff. You have to, direct the treatment coordinators and put out fires with patients who are unhappy about things and manage emergencies. And there's just again so many additional layers to it that we're simply not prepared for. So you mentioning the dental training, I mean, realistically, for dental training to actually truly be comprehensive, there's the clinical side of things, but there needs to be, very straightforward basic courses on just, for example, marketing, on patient psychology.
Yeah,
How do we speak to patients? How do we read body language? How do we, express what we're trying to get across in a better way? Not every clinician has, within their nature, the personality to be super outgoing or energetic or
yeah,
animated. Some people are more soft-spoken or quiet or introverted, and, that's exhausting for them to now have to,
right.
put on that type of show, so to speak. So there's a lot of these layers that again, these are all the things that really add to our day that we don't think about, and that's where you start doing that week in, week out, and have all the extra burden and clinical and then financial stress on it. It adds up.
Yeah, yeah. Yeah, it doesn't seem like one should have to master all of that, but here we are, right?
Here we are.
Here we are. So how do you look at like the idea, and I'm going to say idea of work-life balance? I mean, there's
Mhm.
people who refute the notion that there's such a thing really as a
Yeah,
life balance, or where does work end and life begin, I guess. But
sure.
what's your take on that?
Yeah, it's a good point. I mean, obviously, some of our friends love what they do to the point where they could be seeing patients and working clinically 20 hours a day and they don't feel tired by it. Others, on the opposite extreme. So everybody's kind of meter and gauge when it comes to that is going to be very different. But I do think that there is, in terms of the work-life balance, there's one side of it which simply just comes from your body's ability to physically have a chance to recuperate. We talk about the musculoskeletal breakdown,
Mhm.
and are we taking the time to do things to help it recuperate?
Right. Yeah.
Whether maybe it's just stretching, maybe it's lifting weights, maybe it's going for walks. All these things sound trivial, but they do add up and, create a huge difference in terms of our ability to remain, more fit and be able to take on the physical aspect of it.
Hmm.
That adds on to the mental aspect of things. Or do we have a release of any kind? It could just be a hobby. It could be reading books. It could be travel. It could be, watching sports or, meditation, whatever it might be. But, does our brain have an opportunity to turn off its stress response? Because throughout the day, it's being strained at all times. Because again, there are emergencies, or midway through the procedure, the patient suddenly has a ton of pain, or a lab order that you're waiting on for a big case didn't come in, and now you've got the stress of managing that. There's so many things that come through the day that we don't realize how much our fight or flight response is being activated and staying on
Hmm.
at a constant pace. And again, that causes a huge, change to our endocrine, response later
Yes.
in our career. So again, it's the work-life balance isn't, simply how many hours are you in the office and how many are you not. And everybody's meter on that is going to be slightly different and their needs are, but it's just more, are you providing yourself an opportunity, from the mental and the, physical side to deflate? And are you allowing your body a chance to kind of get back to a resting level? It's kind of like going for a long run. At some point, you can take deeper breaths and keep your heart rate up, but there's got to be a certain time where, you need to take a little break and let the heart rate come down. I can't always be up, at all times, and that's really what we're doing too much of.
Yeah. No, I like that. And I like the the variability, as you're saying, one person to another, and even just that starting place of being able to tune in and actually notice. I think sometimes the paying attention or the lack of paying attention while we're
Yeah.
externally focused, trying to deal with all these things, it becomes easier to violate self to the degree that I was assuming I was fine and I didn't notice that I was increasingly not so fine. So I think that's
Yeah.
a key place to begin.
It's a great point. Our body does such a good job of adapting that it will actually trick itself into thinking that elevated state is our normal.
Yeah, I
And
love
there's
cortisol all the time.
absolutely, and there's plenty, of evidence to that. So our cortisol curve will completely change, and our body will think, well, that's actually our new baseline, and it will stay that way. And therefore, we won't notice that change until time goes on and suddenly things start not really working in our favor. And the only way we can change that is not going to be a quick process at all, but
Right.
we have to go through a whole, essentially a reversal process on being able to shift that into the way it used to be ages ago. And that's something, again, that's not easy to do, and that takes a lot of time. So that's where, again, these incremental periods of through not only the micro day to day or between procedures, but on a bigger scale, weekly and monthly, like what actions are you taking to give yourself some kind of, again, balance, so to speak,
Right.
and that is really where the key is.
Yeah. And I think being able to tune into your body being one of those things to get the clues of maybe I am out of balance, maybe there is
Yes.
too much physical stress demand that needs some sort of attention. But also I think too a way that I think sometimes as leaders don't always want to embrace is the feedback we would get from the other humans around us,
Yeah.
like whether that's team members or our spouse or our kids or like what's being mirrored back to us that maybe
Yes.
we're off at some level.
Yeah, it's so true. That fear of being stigmatized or having that thought of a team thinking you're either weak or can't withstand it or handle it, and it's actually not the case at all. And what the irony is that I think if people were a little bit more comfortable of having those types of discussions, just not for them, not about themselves, but with their own team, I
Yeah.
think next thing they'd realize is, oh, well, the other doctor I'm working with and my staff, they're actually dealing with these same things because your assistant's sitting there with you just in an uncomfortable position and doing this all day long as well. So, they're also going through a lot of those things. So I think the more it's understood that it isn't necessarily meaning that you can't handle it as weak, it's more that you're just recognizing it and you're open to just trying to, limit that and hopefully reverse it for the sake of just being able to do the job longer and be in better condition and better health.
Yeah. Yeah. I know sometimes when I get hired, when people are introduced to me in my people coaching for a practice, the doctor owner will be the need that stimulated that introduction was a problem in the team. Like if you could just fix my office manager, then all would be well with my world. And yet we have a
Right.
conversation. It's like, well, there were previous office managers, I guess, that didn't get fixed either. Right. So
Yeah.
but the idea of being able to begin to see that maybe some of what's happening around me with my team, and I'm seeing these problems maybe as a reflection back towards maybe I am being a bit jerky. Maybe I'm not actually coaching my people. Maybe I'm
Right.
being short because I'm stressed. And I think there's more that we can learn when you say from those external results than we often are taking in.
So true. And again, it's tough again, to play to our side as clinicians. It's tough because again, we weren't prepared and trained for that.
Right.
But we're such driven type A, such a solo profession that we're just used to doing things on our own and in our eyes, if somebody's not picking up on something, then they're slow, they're not getting it, they're not good enough, they're whatever it might be. And that may or may not be the case, but we usually will pass that buck off on them rather than looking in the mirror and taking responsibility and saying, maybe I'm not doing a good enough job communicating what's expected. What are the ways that I need things to be done? What are our expectations? What's our process? And I think that's where things fall in, just like you said with the manager example. If you've had a bunch of them over the years, there's a point where it's like, well, maybe not everybody you're hiring is necessarily not good. Maybe there's something you're not doing well to train them well.
Yeah, fair enough, right?
Yeah,
Fair enough consideration, at least.
exactly.
So thank you for all that. Yeah, that's good. That's good. So shifting gears towards the EarAid, can you tell us a little
Yes.
bit about kind of what led to that, and tell us like what should people know about this?
Yeah, it's something I've been speaking on for about 11 years now. So, again, early career, a couple years in working, like I said, you start noticing things more. And, when you're a student, you see a couple patients a day, not a big deal. But now you're out there in the working world, you're hustling, you're seeing, 8, 10, 15, 20 patients a day, and you start realizing, God, these noises are constant. And everybody knows what the feeling they get when that high-speed suction grabs on to the tongue,
Mm,
and that shriek it makes, and that little, very short-term annoyance that it causes. Or, you're very stressed because you're running very behind and you've got, patients waiting and everything is going south on you. And again, you're hearing these loud, noises, and it just kind of leads to more aggravation. So that was kind of the thought of, well, this can't be normal and can't be good. And, you start looking into the dental and medical literature, and you start realizing, God, this is actually a huge problem. And,
mm,
dental professionals are actually at the tip of the spear with hearing loss issues
mm,
because of, again, our environment.
mm,
So, they define noise-induced hearing loss as prolonged exposure to high levels of noise. And here we are in a career that averages 35 years.
mm,
And there's not a piece of equipment we use in the op that isn't above kind of that permissible level of causing hearing loss. So that was kind of the identification. And so, starting to look at the literature and seeing not only is it making us go deaf, which is only one of our five senses, no big deal,
right, right.
but then you start looking at the systemic health aspects as well, and the direct links to cardiovascular disease, stroke, Alzheimer's, preterm low birth weight babies. I mean, there's such a huge array of effects that we would never, and I certainly would never have until I started looking into this, connected noise to
Mm,
any of these types of
mm,
things,
mm,
but they are actually directly related.
mm,
So, as dental professionals, we're tip of the spear, and we simply have never worn hearing protection. Number one, because it's never been something we've been educated on and pushed on us. But, when we think about it practically, we think, well, if I was to put foam in my ears, well, now I can't communicate with my patients and staff. My ability here is distorted,
right,
so I'm not going to do it. And so that's just kind of where we left it. Nevertheless, we're still all losing our hearing
right,
as
right.
we work. So it was a matter of identifying that and trying to look into solutions and what could be done. And long story short, it worked with a company years ago and developed a product which has evolved and became EarAid for a while. And it was what's known as active hearing protection. So even though you'll be wearing a earplug that seals your ears, there's actual electronic circuit within
Mm,
that plug that will allow you to hear things the same as you would with nothing on. So you can still hear things 100% clear in HD, but those loud sounds like the drill and that high-speed suction, you'll still hear that sound. It just lowers that volume, so to speak, on it. So it will not allow that hearing damage to occur. And more importantly, for us on a more of a noticeable day to day, if somebody puts a high-speed handpiece right up in front of my ear and starts running it, I can hear it, but it doesn't cause me stress. It doesn't cause a reflex of me pulling away. I'm comfortable in that environment. So now when I'm working, that suction catching the patient's tongue and all these other things going on, whereas before it would, irritate me on a low
right.
level chronically. Now I hear it, and it's such a quiet noise that it's like, yeah, the suction caught the tongue, but so what? And again, we don't think about that day to day, but that the health and systemic effect it does to saving us from going deaf, but then also saving our systemic health over time is huge. So that's really where that came to be. And I think the big take home for dental professionals is just to understand that it's a very serious problem.
Mhm.
It's a career ender. It's a quality of life issue. Even if you retire and say, okay, well, I retired, but now you can't, listen to your grandkids talk. And again, the biggest cause of Alzheimer's and dementia is being cut off from your environment and having to just be in your own head, literally.
Yeah.
So these are all things that can prevent it. And hearing loss compared to a lot of health things like, cancer and things that's not in our control. Hearing loss is completely in our control. We simply put on protection and you can, prevent it from happening.
That's great. I love the fact that you can that combination of how you've approached it to be able to protect from certain things, but still facilitate the
Correct.
appropriate sounds. And also, I wouldn't have thought so much about, I mean, the hearing loss part makes easy sense to me.
Yes.
The other part of like not overstimulating the neurology in ways that disturb and distress the day, and then all the physiology that can get disrupted with that. I mean, I think
Yeah.
I learned something good today from our
It
conversation.
just keeps that cortisol that we were talking about in other terms is
Yeah.
just another way that we're keeping it spiked.
Yeah. So for our listeners then to find out more, what's the best way to learn more about EarAid?
Yeah, it's an interesting time now because we had that product on the market for years. Good news is that we went through the product, sold it, and are in the process now of developing a new and improved version. So I would say, and this is the best way to keep in contact with all my things, anyways, through social media on Instagram. It's just at Dr. Sam Shamardi. That would be the best way because we are in talks with the group. We have something ready to go, but it's more an issue of, unfortunately, for manufacturers and a lot of big companies, dentistry is such a small piece of the pie, as we always see with a lot of other things that we face. Everyone's like, oh, for medicine, for manufacturing, sure. Oh, you're a dentist. Well, we don't know. So
Right, yeah.
that's always going on, but definitely still putting out a lot of education about it. Hopefully, we'll have something new to release in the coming very short period of time. So that would be the best way to kind of keep in touch about it. But really, any other things that are out there, even if they're not the same quality or level, at the end of the day, even wearing some kind of plug will still go a long way to helping. So certainly encourage everybody to use whatever they can and certainly stay tuned for obviously the kind of ideal option.
Very good. Thank you. Before we wrap up,
Sure.
a little bit about your book.
Sure. Yeah, yeah. So, that actually happened during COVID time, just being off and having some time. I think it was another one of those things that we discuss of identifying things we all, suffer from. And at that point, it had already been out for over a decade. So a lot of those hard lessons were learned, the long way, let's call it.
Yeah.
But I think, really the concept behind that ultimately is, again, we're not prepared for the business aspect. We don't understand our student loan. We don't get interest rates and what they are. The new grads that are coming out, I do a lot of speaking to them, and they don't know what a corporation is. They've never heard of a write-off. Even with our insurances, there's such a misunderstanding of our disability insurance. What are the things we need in our policy? I've had a couple of close colleagues in the last year or two have health issues and not be able to get despite having a policy they've been paying for 15 years, 18 years, but they're not able to get the reward that they should because their policy didn't have certain riders in place.
Hmm.
And so, long story short, what that book is really trying to encompass is really providing a roadmap to give you an understanding of what corporations are, how to start planning for retirement, what the different insurances are, what things you should be looking out for. So, it's mainly tailored, of course, if you're newer in your career, but certainly even later on, there are lessons in that make a big difference. And it was just really the hope of just trying to provide that education and give people a little bit of a foundation to, not run into these walls like all of us have, and I certainly did.
And people can pick a copy of that up at any.
Yeah, that's the easiest spot I think for most people is getting it on Amazon. It's in there. Again, the book is called the Financial Survival Guide for Dentists. And I think if you go on Amazon, you'll be able to get it, whether it's in hardback or softback. And I think they do it in Kindle as well for those who like to read it on their, little device there. So yeah, it's available. And again, I think it's certainly helped a lot of people, and I still am asked to travel a lot to different conferences and speak on this topic. So it's certainly something that I think it's still in need.
Yeah, that's great. Well,
Yeah.
congratulations on accomplishing all of those things,
Thank you.
making those contributions. And I know you're like, when they go to Amazon and buy the book, you're making a fortune off of that.
Oh God, I
You get
wish,
like 50 cents or a dollar.
Yeah, I think maybe if 10 people get a book, I might be able to get a black coffee with maybe a little cream at Dunkin' Donuts with it. But
Yeah.
yeah.
Yeah. I wrote a book and self-published it back in 2008, and I remember that being a rude awakening as to let's see, yeah, you get about $1 or something.
Yeah, yeah, definitely. If you're doing something like that, it's definitely not for financial gain. It's
No,
more just to try and help, that's for sure.
got a message, and somebody needs to hear this. Yeah.
That's right. That's right.
I really have appreciated our conversation. I've enjoyed the topic areas we've discussed, and so thank you. I appreciate.
Thank you. I appreciate it. Yeah, appreciate being on.
Yeah, thank you. So, everybody, I just really encourage you to reach out to Dr. Shamardi. And again, you said the best way is,
Yeah, Instagram would be at Dr. Sam Shamardi, or my just website, www.drsamshamardi.com. That's probably the best two ways. LinkedIn as well, I'm sure, but I think the other two tend to be the most direct.
okay, awesome, awesome. So, thanks for watching. This is the Truth Behind Dentistry podcast, and I think we dug into some key truths with Dr. Shamardi today. So, please subscribe if you haven't, and tell your friends, and look forward to seeing you on the next episode. Thank you.